Back now on Triad today. I always like it when we can grab this gentleman and get him over here. He's so busy and he sees patients and does a lot for a lot of good folks. But we got him over here, so we're going to take advantage of his knowledge. Next to me is our good friend, Dr. Andy Schneider. He's a surgeon with Forsyth Plastic Surgery located in Winston-Salem. Good to see you, sir.
Thank you for having us.
I read somewhere that about 1 in every 26 women has a breast implant, and of course, the reasons are varied. So I'm assuming you do breast implants for both medical as well as cosmetic reasons, right?
That's right. We use breast implants for both cosmetic reasons, mainly an augmentation. A woman wants to have fuller, plumper breasts, or reconstruction. A woman's had a mastectomy and needs to be reconstructed. We use implants all the time for reconstruction. So yes, there are a lot of implants out there. It's something we do a lot of. A lot of women have implants. A lot of women are thinking about breast implants. So it's a good thing to talk about.
Yeah, who would be a typical candidate? I know you mentioned some categories, but I mean, are there certain restrictions? Should you be a certain age? Like, should you be over 18? Should you be under 80? Should you be, I mean, do you keep any of these things in mind as a restriction?
Yeah, I mean, you know, there are several folks that we see. There are young women that come in that maybe want to have fuller breasts in their 20s, so we see them. There are some women that are older, maybe they've had kids, they've breastfed, their breasts have enlarged and they've shrunk, and now they kind of feel a little deflated and they want to get their more youthful look back.
Right.
We even see, older women, maybe in their 50s, who want an augmentation. Then, of course, women that have breast cancer and have a mastectomy, I mean, we see women as young as late 20s, early 30s who have mastectomy for breast cancer. So It's really the entire range of folks.
Do men, I know we didn't rehearse this or anything, but can men have breast implants?
No.
No.
Do you want some, Jim?
No, I'm too fat around here anyway. I just wondered.
I mean, there's no law against it, but
right.
No, we don't really see men.
Because I know that a lot of men do get breast cancer, and so I was just curious about what you do in reconstruction with that.
Yeah.
Now, let me ask this: is this a relatively safe, easy procedure?
Well, it's a safe procedure. Every procedure has some risks associated with it. So whether it's an augmentation or a reconstruction or a lift with an implant, they all have some risks. But in general, these are low risks. And what I always tell folks about implants is that these are very safe devices. They have been studied for decades, and they're on now multiple generations of improvements of the implants, but they don't last forever.
Oh, now how would you know? I mean, is there a time where you say to the patient, okay, you're 35, you need to come back in X number of years, or what do you say?
Not necessarily, but we do tell women that if they notice any changes in the implants, if they get hard or they start to look deformed or something, it may be that it's time to replace them or do something like this. On average, I usually tell my patients they probably can get 20, 25 years out of a breast implant. But if you're seeing a young person, maybe in their 20s, I always tell that patient, there's no way you're going to, if you want to live to be 80 or 90 years old, that implant's probably going to be around, you might have to have it replaced when you're in your 40 or something.
Yeah. Do you perform the implant procedures in your surgical suites in your office, or do you go to the hospital, or how does that work?
Well, we do them in our office if it's a cosmetic reason. So if a patient wants a cosmetic breast augmentation, we do those in our own surgery center, the Plastic Surgery Center of North Carolina, in our office. If it's a reconstruction, like somebody's had a mastectomy, we typically will do those at the hospital.
Okay.
Yeah.
Now, you mentioned something a while ago about a lot of women think about it. Very quickly before time runs out, that thinking process is sort of a consulting time. What's a good time to come talk with you?
Well, we know that the average woman that comes to see us has been thinking about it for usually a year or two. They just don't wake up in the morning and say, hey, I'm going to go see a plastic surgeon that day.
Right.
So they've been thinking about it for a while. Most of the time when they come in, they've researched on the internet, they've talked to friends, they know about breast surgery, they know about breast implants. They oftentimes know everything they need to know. But really, anytime someone wants to come and see us, they're welcome to call our office, make an appointment. We can discuss them, the risks, the benefits of the procedure, the complications that can happen with implants, the safety aspects, all these kind of things, because there are a lot of aspects to it, and we really want people to go into surgery knowing all these things.
Absolutely. Up on screen, speaking of doing things at the office and the surgical suites, Forsyth Plastic Surgery located 2901 Maplewood Avenue in Winston-Salem. The website, forsythplasticsurgery.com. I'll say it again for the radio listening audience, WSJS, forsythplasticsurgery.com. Number is 765-8620. Dr. Andy Schneider, you're going to stick around and help us with the roundtable, too?
Would love to. Thanks.
All right, sir.
Good to see you.
All right.
Thank you.
We'll be right back after this.